Hey, I'm Catherine Flatley, and I'm the CEO of DevelopLink. DevelopLink is a real-time market research platform for healthcare professionals working in emerging markets. Basically, what we do is we collect de-identified data from healthcare providers, ranging from public hospitals to private hospitals to free clinics to international medical aid efforts to private doctors' offices, and we collect de-identified data from them, and then we aggregate it, and our platform generates analytical reports. Basically, from a business model standpoint, the way this works is that healthcare professionals sign up for subscriptions. So they log in, they select the types of data or information they want to see. So if they were a generics pharma company, they might be interested in prescription trends versus disease trends in a small city so that they could better plan their R&D for generics in the future. But if they're, say, a governmental organization like the CDC, they're interested in information like how HIV is spreading in particular areas, so that way they can map that information relative to their programmatic decisions and figure out where they should better allocate their resources. So people, again, they sign up for subscriptions, they select the types of information that they want, and then they pay a subscription fee corresponding to which tier of information they're requesting, and then they receive access to real-time reports they can log into anytime, and that's continually updating on a regular basis from the different data sources, which again comes from the different providers. So we collect data from providers and then we sell it back to a variety of different professionals within the healthcare space. And we're piloting in Guatemala, which is a pretty small country, but we really did that because we had a lot of support from the government and we don't want to be reliant on them in the future, but having tons of governmental support was really helpful towards getting ourselves off the ground. And we're looking and scaling this in two different ways, and so we think that there's a ton of market opportunity. The market's really, really large. The first way we're looking at scaling is we want to look at other markets, and so we're considering moving into Mexico in 2016 and have begun conversations there. So again, Guatemala is the starting point, but we really see this as being something that can be scaled to essentially every country in the world. And then we also see that there are tons of different groups that are interested in buying this data that we didn't even initially anticipate. For example, insurers. We just didn't realize, that wasn't something that was on our radar at first, but we've definitely started having some different insurers that are interested, and we've seen some investment firms in our pilot country of Guatemala express interest in this data. And so I think that there's a really, really huge market opportunity and it's an extremely scalable model, particularly because a lot of the different groups we work with and our potential customers are working in a bunch of different countries. And so if we can get them in Guatemala and we can prove this is valuable, we can hopefully work with them in other countries as well.